Welcome everybody. This is the second webinar on the group. If you missed the first one and you want to watch it, you'll find it on the Equimec YouTube channel. And tonight I am introducing Martin Payne, who I have known for about 25 years.
Shush.
And Martin's given me an even bigger figure because he said he started his apprenticeship about 40 years ago. So
feels like yesterday.
Quite a few achievements here. I've picked out the main ones. So he started his apprenticeship 40 years ago and then acquired his associateship of Worshipful Company of Farriers. They're going to have to shorten that, Martin.
WCF.
He achieved that in 2001 and has lectured at Kildare and Caffrey Farrier Schools and has been a guest speaker for Red Mills, the Irish Thoroughbred Association, HSI, pony clubs, amongst others. And currently Martin liaises with other equine professionals just ready to improve soundness, comfort, longevity in our equine partners. So just to say, if anybody has any questions during the webinar, you can put it in the chat box and Martin will see those once we hand over the reins to him, or at the end we'll open up for questions as well. So over to you, Martin.
Okay, now we'll try this, Lisa and John, and see if we can do this. Firstly, there's a few thank yous. I usually do this at the start because I usually end up forgetting to say my thank yous. So firstly, I'd like to thank Lisa for asking me to deliver tonight's webinar for you. For John, Lisa's tech guru in the background there, seeing bits and pieces of him earlier on. And thirdly, to everybody who has joined us tonight to listen to me speak about my profession and some of the experience that I've gained over, like Lisa says, 4 decades. I'm a practical farrier, just trying to give equines the best that we can give them and look after them as well as possible for the owners that ask me to come along and look after their hooves and basically their well-being. As a young apprentice starting out, I was probably guilty of not connecting all the dots, to steal Steve Jobs' line. I didn't appreciate the fact that I was shoeing the whole horse. I probably just looked at it as a horse's foot attached to a horse's leg. And even in college, a lot of focus was placed on the horse's hoof, the capsule, the structures inside, structures be knee and hock, and below there wasn't as much detailed information given to us as farriers probably back then as there is now about the whole horse and how important it is for us to think about that. Obviously, in hindsight, that was a very limited view, and the importance of farriery for the whole equine. But throughout the 80s, farriery took a big step forward, even from the tools that the farriers were available for us. We had fast developing tools used, and shoes and materials were becoming better, more versatile, that we fitted to the ponies and horses. Again, we did this on the back of trying to improve the comfort, performance, and longevity for whatever discipline your horse or pony was undertaking. And I suppose at this time there wasn't very much scientific papers or research carried out by farriers for the benefit of your everyday farrier to take out and apply. But that said, going fast forwarding to sort of recent times, in the last at least 10 years, there has been a lot more papers published by working farriers, studies done to try and back up what we do every day. The use of even the modern technology that high-speed cameras, gait analysis sensors and software, apps for the smartphone, CT and MRI scanning. All of that has been used to try and understand the hoof, how it moves, how the whole horse moves, and the connection between locomotion and what the farrier does, and how maybe that can also aid in trying to return horses to soundness, to work. So it's all been a very fast moving journey when the last 10 years, quicker than probably the 80s. Again, as we all know, smartphones can take over everything now. But this information that's gained from the research has led on to an understanding of how good farriery, with correctly applied, when correctly applied by skilled, interested, and passionate farriers, can provide the foundations for your horse to generate force and power while providing protection and support in whatever discipline you compete in and you take your horse into. So it's important that I feel that even modern day farriers go in with an open mind, look at what information is out there, take it on board, think about it, discuss it with their owners, look at horses walk, move, even before shoeing, because it gives them a better insight and hopefully a better shoeing plan for use for your horses to move forward. So carrying on from that, I'm going to look at what we're here slightly more focused on what we're looking at tonight. And this is a book by Ross and Dyson, The Diagnosis of Lameness in Horses. And some of the paragraphs or some of the sentences below indicate that, the back problems that we see, whether they be fusion of the spinal processes, kissing spines, or other back problems, they do affect the whole horse. They will affect the locomotion of the horse and how it moves. And once that becomes affected, then the feet become involved in how they're placed on the ground, how well they can absorb concussion, because the foot or limb is being placed in an abnormal way, because it's compensating for pain higher up in the body. It'll stand slightly differently, might stand with its feet underneath itself, not giving itself a proper base of support. So it's interesting to note that all these back problems can influence the whole body, and vice versa. If our horses are not shod correctly, then we make them stand in positions which the bony structures and skeleton and tendons and muscles can't cope with, and then other structures have to compensate for that. So moving on, I'm just going to run through some of our aims for tonight, what I think we can get through. I think Lisa's put me on a bit of a time frame for about 40 minutes anyway, or thereabouts. So the aim of tonight's talk: understand the benefit of correct foot balance and regular correct shoeing for your horse and pony. So that's trying to get you as an owner to look at your horse's feet, understand maybe how it should look. Now, every individual horse and pony will have its own correct balance for it, and will require its own bespoke or specific shoeing plan for your horse or pony. Identifying hoof morphologies. So that's a sort of a buzzword around farriery at the minute, is morphologies. So that's basically changes to the hoof capsule away from what we see as the norm. And they can have a detrimental effect on other structures within the hoof capsule, blood supply for one, and other ligaments as well. So having a look at the morphologies that you may come across, trying to identify them, are they happening in your horse? And then looking at, can shoeing help those? And maybe if you start down the road of remedial shoeing, can you continue that for the longevity of your horse's career, or will you need to? Because once you start down the road of needing orthotics put into your horse's feet, then it may be a time when you need to start continuing that on, because if you start to change the plan and say, right, we'll try them without them, you might find your horse's performance or soundness doesn't go as planned. Okay. So this is a quick recap on some of basic terminology and anatomy that I'm going to run through first before we get on to the actual looking at some of the more, I suppose, interesting feet and some of the cases that I'm showing at the minute and have shown that we have used different shoeing plans on to try and help and how successful it's been. So 60% represents 60% of the horse's body weight. It's carried on the front limbs. This is mainly the load-bearing end. And the hooves are usually a rounder shape due to this fact that they are load-bearing. 40% represents the weight distribution over usually the hind limbs. But this is where your engine is. This is what propels your horse forward. So sometimes it's sort of the neglected cousin. The hoof capsules behind can succumb to the same deformities as the front, but don't seem to get picked up on just the same as the front feet. Everybody seems to, the majority of people seem to focus in on front feet having low heels, long toes, but the same similar sort of thing can happen in hind feet, as you'll see later on. So it's important that all aspects are correct, and if you want your horse to use the engine behind and propel your horse forward, whether it be doing your dressage or whether it be jumping, if your horse is just changing the balance and working off its hind legs, they need to be correctly balanced and shod and be in the right position, just as much as the front feet do to take all the load and shock absorbing. So it does. So it's having a look at that as well. Again, we're going to stay on anatomy for another 1 or 2 slides, just I promise, and then we'll move on. So I've put on this sagittal section P1, P2, and P3. P1 being the long pastern bone. It dictates how far your foot sits away from the limb itself. So the length of it and the angle at which it comes off the fetlock joint will determine how far your foot is away from the limb. So that may determine if you have a long sloping pastern, that there's more weight dispersed over the caudal part or the palmar part of your back of your foot. And the shorter, more upright, your foot might be underneath the limb a little bit more, and you have more concussion issues coming that way. P2, it's a short pastern, forms part of the coffin joint, and that distal extremity is inside the hoof capsule itself, and it articulates there with the NB, which is the navicular bone at the palmar aspect of the joint. P3, that's your pedal bone. It's a light, dense, porous bone within the hoof capsule. One of the 3 bones that forms the coffin joint. It has 2 tendons attached to it, along with 2 lateral cartilages, numerous ligaments, and the laminal dermis, which provides the blood supply and interlocks with the epidermal laminae on the hoof, inside of the hoof wall. It should sit normally at about 2 to 7 degrees inside your hoof capsule, and that's seen as being normal. But again, later on, you'll see some pedal bones that don't sit in normal, and sort of what to look out for, and that can be seen on the external hoof, how things are sitting inside, if you can read the hoof capsule a bit as well. So you've got the navicular bone at the back. Again, it's a boat-shaped bone, which forms a fulcrum for the deep flexor tendon to course over its flexor surface. And it has a bursar just between the tendon and the bone. So it's the one that nobody wants to hear mentioned when you go for a lameness inspection, but there is a lot that can be done, and shoeing can do a lot to alleviate some of the pressure of that. If done in a proactive way rather than a reactive way. So looking at your horse's feet and thinking, right, well, they're not perfect, but how can we alleviate any other structures within that with the shoeing plan? You've got your DDEFT, which is your deep flexor tendon, and your CDET the common digital extensor tendon. And both of these structures, they're tendinous, they're a continuation of a muscle which is higher up in the limb. Through contraction, the flexor tendon starts to break over. Your extensor tendon, once you get the toe off, will extend the limb forward. The DC is your digital cushion. It's it's going to support, lies below the deep flexor tendon, above the horny or external frog. It's going to support your or your coffin joint. Once your foot is totally loaded, the fetlock is depressed, and it expands and moves and helps to absorb concussion, push into the lateral cartilages, return blood supply up the limb. So it's a really important structure. But unfortunately, when horses' heels become low, we lose digital mass, digital cushion mass. So if we lose that, it can't regenerate itself, and then we're losing the peel bone, coffin joint, and other structures become closer to the ground, and there's just not that shock absorbing impact that it would have. You've got the hoof wall and the frog, the coronary dermis, where your hoof wall grows down from. It's got the palei coming from that. You've got horn tubules go down. So that's where hoof wall comes from, that we see the horse standing on. It's quite a supportive structure, obviously, taking on average 16 hand horse, 500 kg on 4 feet. But it does have its weak points, as far as if the angles are too low, the environment that's standing in, it can deteriorate as well. And again, you've got a farrier coming along trying to trim it down, burn shoes on, and nails bits of steel to the bottom of its feet, or glue stuff to the bottom of its feet in some cases. And I'm not discounting that there are horses out there that go barefoot and are looked after and competed without shoes or anything on. They are higher maintenance horses, in my opinion, compared to they just require the same type of maintenance as the shod horse. They have to be done regularly to maintain the integrity of the hoof structure and the structures within inside the hoof capsule as well. So the frog itself, it's the external shock absorber, a rubbery consistency. But it's got a higher moisture content than the hoof wall. The frog is about 40% moisture, the hoof wall on average 25%, which leads the frog to being prone to more bacterial fungal infection, given its position within the foot. So it's just something to bear in mind. But that's a basic run through of structures within the foot. They're quite complex, and it's just not the farrier coming out and trimming feet and putting nails and shoes on or glue on, or just trimming feet. What we do to that can affect all those structures, and they have a job and a role to do. So it's important that we look after the health of the horse's foot, because then those structures, along with the blood supplies, will also be well looked after. Same slide, same picture of the same hoof again, but I've put on a few markers here. So the COR that's the center of rotation. So if I drop the line, that green line goes down and bisects the blue line on the base, which I suppose represents the shoe. It should generally bisect that in the middle of that blue line. So you're looking for your shoe to be centered below the center of rotation. And that way we can say that the foot is balanced and supported for the duration of the shoeing cycle. But that depends on the hoof form. You might need to have more shoe extended out the back. You might need, if the toe angle is lower, you might need to add in a toe variation or change the profile of the shoe that you use. The center of force, the COF, it's a place that is, you have the insertion of the deep flexor tendon on the pedal bone on the solar surface, and then in the extensor process where the red line finishes at the top, you have the insertion of your extensor tendon. So that's like the balance point. And there was a UK farrier who's done a lot of study and research into the horse's foot and anatomy, and he has given these external reference points. So on a horse's foot, these have been proven to be pretty accurate and very repeatable, and this is why the studies and the research and science papers, we can take the information for that, and then we can use it as farriers to position shoes around coffin joints, look for the point of force for positioning off even like hard bar shoes. So we get the benefit out of the shoes that we're using. And even on distorted feet, these landmarks, external landmarks, won't change. So it's important that we use, well, I feel I use them now, and I use them every day to position shoes around feet, whether they be distorted or not, to make sure that the horses get the best possible support. Along with all those structures within the foot, I've just put two diagrams up quickly that show all the tendons, ligaments that are in the lower limb, the blood supply on the right, which is arterial red, blue is for your venous return, yellow is for your nervous system. So the foot is a really viscoelastic structure, living structure that we work on and we look after on a regular basis. And so it's important that you have good foot care and have good farriery relations to make sure your horses are going forward in the right way. Now on to some of the more nitty-gritty stuff. I've put up two pictures. The one on the left is forelimb, standing correctly, as good as I can get it, really. Standing square, shod. The green line represents the hoof pastern axis. And this is one of the first guidelines we use as farriers to see that the three joints in the lower limb are lined up correctly. Once these three joints are lined up, then hopefully when the horse starts to do what it has to do, move, trot, gallop, canter, that those joints will be loaded evenly when we have this as a starting point. The blue line is the dorsal hoof wall. It should be parallel to the green line, or the hoof pastern axis, and the red line ideally should be parallel as well. So we have those three lines in the ideal scenario. That should work like that. Sometimes the red line will be slightly lower than the other two, which gives you what we call, when it's more than 5 degrees lower, an underrun heel. So your heel is starting to collapse. You'll see a picture of one of these later on. Each individual horse could have a different green line. We'll call it a green line, your hoof pastern axis. Some might be more upright than this. Some might be slightly sloped in this. As long as they're straight, that is correct for your limb. That green line also will line up with your horse, your shoulder of your horse. So if your horse has a more upright shoulder, you can generally say that the horse's pastern axis will be more upright, and vice versa, sloped will be more sloped. So that would be the front end. The hind end, the picture on the right, the green line, the hoof pastern axis is straight. Generally, if this was seen in the same horse, the angles would be slightly more upright for a hind limb. So on a front limb, the old textbooks would have said 45 degrees, but they reckon now that that's a wee bit too low. And in and around 50 degrees, 48 to 52 degrees can be seen as normal for a front limb. On the hind limbs, anywhere from roughly 50, 55, even 60 degrees on hind limbs, just depending on the individual conformation as well. But as you can see, the toe angle, the hoof pastern axis, and the heel angle all line up. I've tried to keep the lines as thin as possible, not trying to hide anything that was by the hooves, but it's, if we can keep those lines as farriers, and if you look at your horse's feet when they're just shod, and you have that sort of alignment, then hopefully your posture and your horse will have a better supportive structure. You can notice that the cannon bone on both the metacarpal on the fore and the metatarsal behind, they're in a vertical upright position. They're long bones. They're supposed to be supportive like that. The fetlocks are in good supportive position below that. And the shoe, I put the green line to the center of the fetlock joint. So if I dropped another vertical line down, it would become close to the back of the shoe. That doesn't seem to be a problem for most of us on hind feet, but on front feet, we end up having horses that pull shoes off quite frequently, and so we end up, the farrier gets under a wee bit of pressure or doesn't want to be having the shoes pulled off the horse too often, so we end up shoeing a little bit shorter with the front shoes, and that can create this underrun heel. The toe angle might be good, it might be parallel with hoof pastern angle, but you end up with a heel angle which has become distorted and needs probably more support than what is being given, because it keeps pulling shoes off, and it's a vicious cycle. So it's just something to keep in mind, that when your horse is shod, that's the sort of thing you're looking for. The angle of the green line will be individual to your horse. So, but it should be straight. That's what you're aiming for at the point of first day of shoeing, and when the horse is done as well. So talking about the shoeing cycle, Lisa, if you can give me a wee nod if you think I'm running on too long, and I'll speed up. So we will. Talking about the shoeing cycle, the shoeing cycle is, it will be determined by various means or requirements. It may be down to the horse's conformation. It may be down to the discipline it's doing. It may be down to if the horse is being shod for a particular pathology, lower down. It may be down to a gait abnormality, where the horse might be tripping and needs shod more frequently. It might be an older horse. So there's different reasons why people pick a different shoeing cycle. Generally, 4 to 8 weeks, I suppose, falls into everybody's bracket. 4 weeks, you'll have race horses shod at that stage, because their shoes are fitted to the feet, no longer, no wider. And if you think on average, an adult horse's foot grows at force a quarter of an inch every month. If that shoe is on for more than a month and it's shod no longer than the last bearing point of the foot, it will be 1/4 of an inch further forward than what it did on the day it was shod. So you start to lose support in the softest, most youngest part of the hoof wall, which is the heel. Other horses, if they're shod, like show jumpers and dressage horses that work in arenas that maybe aren't at the same pace as the racehorse, and are maybe in a better surface than a horse galloping on soft ground. And those two types of disciplines, you can shoe them with a little bit more length support, as we call it, and that gives the horse a bit more platform to work off, a better base or foundation to work off. So it's important that you come up with whatever shoeing plan is correct for your horse. If your horse has a conformational defect, like a horse that is upright pasterns and its heels are quite low, or it's back at the knee and its heels are low, it's toed in, and like you get a flare on the inside of your horse's feet, or even behind if the horse is sickle hocked and stands with its feet underneath behind, then the hoof capsule is going to be under more strain quicker. So the shoeing cycle may need to be a little bit shorter. You need to bring it back to 5 weeks instead of 7 weeks, so that your horse isn't competing on feet that are too long and not given appropriate support and protection for that period of the last 2 weeks that you're competing on it. Because your horse should be, if your horse is shod, and it's generally shod all year round now, not very often horses are let off for 2 or 3 months at a time now. There's generally something to do all year round. Your horse is standing on those shoes 24/7, 365 days of the year. So the only time your horse's shoes generally come off is when the farrier comes out, takes the shoes off, trims the feet, and fits new shoes. So you want your horse to be standing on those shoes comfortably, without any impairment on any foot function, from day 1 it's shod to day 5 or week 5, or 6, whatever it may be, so that you can see your horse standing on those feet. The 2 pictures that I've up on the screen are of a thoroughbred. The first picture on the left is before it was shod. This horse unfortunately ran at this stage and didn't have a great result, because it broke down on both tendons, one on each leg. You can see the hoof pastern axis. It wouldn't be straight on this. It's bent. The heels are very low, the toes very long. The horse is not standing in a very comfortable position. The cannon bone is inclined forward. Whereas the horse is just shod, that's the same day the horse was shod. I took those shoes off, trimmed its feet. This is a number of years ago, and put those shoes on. And the horse immediately stood in a better position with its cannon moaned how they should be. The hoof pastern axis is basically straight. The horse does have a heel, but it was so crushed and underrun, or in the wrong position. You can't even see the shoe that's on the left picture. So that's just by shoeing, and that there's no graduation pad on that. That is just a flat shoe. It's a natural balance shoe. It's positioned. I use that to position it back because there's only so much hoof wall you can take off in this sort of scenario. You can't really go and take as much hoof wall off as you want all the time. So you have to, especially if you're fixing shoes with nails, you have to allow yourself maybe 2 or 3 chewings to try and get things as correct as you can, or you'd pick a shoe that is positioned around to give the biomechanical effects that you want and support that you want. So it's just something to think of, that when feet get too long, it just shows you how joints and other structures can adapt to them with unfortunately not great or poor consequences. So what is the effect of having these hoof capsules that are out of shape on their posture and gait? Imbalances in weight distribution. I've seen in the last one, things change. Even the horses with these problems with their front feet, they're going to probably put more weight on their hind legs or throughout their whole body. Their musculature over a period of time will change if this continues to be a cycle. They will obviously, deformed feet can alter stride length and even make horses, if they were competition horses, they may even make them start to strike themselves, hit themselves, have interference injuries. You can have uneven gait, discomfort, and even lameness with them. And these hoof capsule changes can come quite quickly, just all of a sudden. And it's just being aware of that when you are looking at your horse's feet, working with them, cleaning them out, picking them up, speaking to your farrier, looking at them. And again, it can come the other way around as well when we're talking about kissing spines. If our horses' backs, they're not comfortable, we don't maybe don't pick up on it just as quick. We notice changes in habits, girthing, or brushing over, saddle on, rider on. The farrier might start to be the one who points out to you, his feet are starting to change here. We need to have a look. Is there something going on elsewhere? But that's hopefully, your farrier's tuned in. You've got a regular farrier. He knows your horse. He knows your horse's feet, and things are starting to change to him. And hopefully, he'll make you aware of the changes, and you start to put all the clues together, and hopefully, you can come up with something that you can find, or get a diagnosis that you can find where the problem is sooner rather than later. And he can help you with the feet that are starting to change. And hopefully that will make the horse more comfortable, or you get a diagnosis of something else and you realize what has been going on. Again, soft tissue issues, bony structure problems, and back pain. So it is, sometimes it's an indicator of something else happening, or sometimes it's the start. When the feet are poor, then other problems start to occur. It's one of those chicken and egg syndromes or situations. What comes first? So just trying to stay abreast of your horse's feet being good, healthy, strong, as good as they can be, and speak to your farrier about that. I said we'll talk about P3 shoulder position. Earlier on, I said it was to be about roughly 2 to 7 degrees. Again, that can be individual for each individual horse and even each individual limb, because you've probably heard of odd feet or mismatched feet, or high-low syndrome as it's termed now. Big flatter foot on the right forward for talk's sake, and a more upright boxy one on the left. So those horses can have different problems with their feet. They can have different positions of pedal bones and angles relative to the ground. But I've put 3 of the sort of straightforward, what we come across, or what I come across on a regular basis. So the first one on the left would be positive. So it's not overly inclined. It's not a high angle of 7 degrees, but probably about 2 or 3 degrees, which is normal. There's below the red line, there's good solar depth, which matches the distance between the dorsal border of the pedal bone and the external dorsal hoof wall. So that's pretty normal. The position, if I was to drop a green line down from the center of articulation, is in the middle of the foot. Everything looks good. So again, the hoof pastern axis is lined up. Everything's looking healthy enough. The next one, the red line's flat, so it's parallel with the ground. And this one's shod. The position of the shoe is probably whether the horse is needing shod or not. It has moved forward anyway from a good supported position below the coffin joint to slightly having, say, a 70% portion of the shoe out in front and 30% behind. So we're losing some of that. This horse might benefit just from a normal shoe, change the shoeing style, take a toe clip off, put a shoe with a better breakover or a profile on the toe of this, and extend it just a little bit behind. So that's straightforward enough. It looks like it's got enough solar depth there that that would be fine to do that with. The last one, negative, shows the pedal bone in a far more upward position at the toe. A lot of toe excess below the tip of the pedal bone where the clips are, and at the heel where the red line finishes, it's sort of going backwards. So everything is dropping through the foot. And we find nowadays, there was a question asked at a seminar I was at a number of years ago, is this the end of open heel shoes? In other words, seeing horses with these like prolapsed feet that are dropping through open heel shoes, would they be better shod with bar shoes, pads, packing, to support and mimic natural ground if they were barefoot? So it's sort of food for thought, really. So it is. But that last foot, you can see the front of the hoof wall. It's a bit rounded. We call it bull-nosed. There's a lot of depth in that. And if you usually find these feet are they're quite deep at the point of frog. If you picking them out, they can get, particularly the hind ones, they can get quite thrushy in there, soft, sensitive. And again, all of these three can be seen in front or hind limbs to some extent. And it's just trying to put things back to what we think is normal. You can let the hoof pastern axis on the last one, the negative one, it's an upright long pasture, and then the P2 is at a different angle, P3 is at another angle to that. So everything coffin joints taking a lot of loading and pressure. That's just something, food for thought, and looking at x-rays, and speaking to your vet and getting them to talk through you with them, it's really good. And even if you're buying young horses, sometimes a set of x-rays to see where things are, and you can be referred back to later on if you do have any problems. Something that it comes around a lot, and a lot of the modern shoes have got breakover built into them. This is the point at which the foot comes off the ground, and we create movement, I suppose. So this is where the deep flexor tendon muscle sort to contract and start to lift the heels off the ground. And then around the toe, it moves around the toe, and then it's taken on by the extensor tendons at the front. So ideally, breakover should occur in the centre of the toe, and that's for front and hind ones. Well, slightly off centre for the hind ones, but given the position of the shape of the pelvis. The portion of the toe that breaks over, it should occur naturally. The longer the toe would get, the more it's going to be an effort for the rest of the structures within the foot and up the limb to take that foot off the ground. So trying to make things easier for horses is really important. The pictures that are on this slide, they show different types of shoes. The left one at the top, an aluminium shoe, it's breakover all the way around, apart from the heels. So it allows the horse to move really easily. The one below it's a natural balance shoe. It's positioned in a certain way to give that breakover is below the tip of the pedal bone. The padded one just in the centre at above, it's a graduation pad. We see a lot of these now 3D printed pads. Probably, there's a lot of horses out there. Every time I turn on Facebook or Instagram, there's pictures of these all over the place. Where it's a marketing ploy or whatever, I'm not quite sure. I do use them. There are benefits to them, but there are also a downside to using those type of products as well. So being mindful that you get the benefit out of them at the start, and when you start, things start to change, your performance starts to drop. Maybe rethink and look at what you're doing, how your horse's feet are they performing at these pads, doing what they're supposed to do. So it's just being mindful that things do change. The breakover on the shoe below that is a double elliptical bar shoe. It's graduated, so it's higher at the heels, but the toe has been ground to allow this foot to break over easier. A steel roller motion shoe and a bar shoe fitted with an equilibrium toe. So there's lots of different ways farriers can either buy a shoe or the likes of that last bar shoe with the equilibrium toe. That's a handmade one. So there are lots of ways we can accommodate and assist breakover to make your horses move, even though they may be feeling stiff in their spine and their gait has changed. Facilitating breakover is a great aid to get your horse to keep moving as fluid as it can and as sort of pain-free as it can. Is probably the best way to describe it. The effect of long toes on the posterior hoof. Long toes create more pressure and load on, again, the yielding and soft part of the horse's foot, which is the flexible structure, the heels at the back of the foot. You can protect them. The first picture has long pasterns. It's a dressage horse. It's got 8-bar shoes on, but it needs that length of shoe. The heels are a good angle, in the same angle as the toe angle on that foot, but it needs that because the pastern has placed the foot further away from the limb. The second one, it's a nice fancy red Italian padded shoe. Again, it protects, it's graduated, it's got dental impression material. It's a combination of a 3D printed pad and a leather pad. So, and the last one is a bit more robust. It's a welded in insert with dental impression material. That spreads the load a bit better than maybe a pad, and it's more rigid. So if you've got a hoof capsule that's probably a little bit more weak, then this might give you a little bit more rigidity to your hoof capsule as well. So it's picking and choosing what's good for your heel area to protect it, to keep it in the right position, and then allow your horse to move off after that. Speaking of moving off, this is just a quick 3 videos of how horses should land. The top one's playing at the minute. They'll come into view in a second. It is 4 feet, the front feet, and they should land level, flat. And when we see them, if you had a high-speed camera, that would show you them landing slightly heel first, or sensors would show you heel first. Hind feet should land level as well. And you should watch where the fetlock goes on places. The second video clip on the right-hand side is a horse with a conformational rotation of its right fore. So it will land outside first and then load medial heel. So again, this affects how the hoof capsule is and how we should shoot it. The right, that one has just landed, lands pretty level, but the next one lands slightly out, biphasic we call it, 2-part landing. And then the last video at the bottom, both feet land level, but the white foot, the near fore, its fetlock drops to the outside. So we always want to look where fetlock drop is, because that's where the load is going. So the load's going to the outside. This horse is a fetlock Barris, toed in conformation. It's got a lateral support shoe on it with some glue to help support that. But the fetlock drops to the outside. So dynamic balance is important as well. Level footfall, but putting a shoe on to accommodate where the load is, which is really important. So we're getting to sort of the last part of it there, where sort of some of the case studies are. So the green line, that was the center of rotation of the coffin joint inside on the sagittal section at the start. This is the green line, still represents that on the external landmarks that I work around every day. So the picture on the left shows the green mark, which it actually lines up with where the bars of your horse's foot terminate naturally. Now, these bars can grow forward. Once they're trimmed back, they should be, and you can see it better on the picture on the right-hand side than you can on the left. But it shows you how much the blue line represents where the bottom of it, where the breakover is, and where the widest point of the foot is. That's just the last bearing point. So we can see between the green and the yellow line, we haven't got very much shoe to support this foot. This needs shod. There's quite a distance to the breakover at the toe. And then on this foot that is unshod, the green line represents the bars where they terminate in the foot. And that would, if we were to again look into that, that would be their center of rotation. The heels have migrated forward. The toe is long. And so everything, that's how much the horse has got to stand on the, or load the back part of the foot, is between the green and the yellow line, which is quite different. But we'll see this case again as we go on. Horses shod. These are ones that I shoe. This is my shoeing every day. The picture on the left is quite a big horse. Again, the green line lines up where the bars terminate in the foot. We take that, how much shoe we've got behind. The blue line finishes. This has got an equilibrium toe on it, so you can see where the breakover is. So roughly, we're getting close to this one on the left. Could do slightly more back, but you know we're not far away from it in this position. The pony on the right, it's got really good foot balance. The blue line finishes where the toe has been ground back to help the breakover, and you've definitely got more than 50% of that behind the green line. So again, you can see these proportions in any horse's foot, front or hind, and that's what you're looking for. When your horses are freshly shod, that you've got that good balance, healthy feet, and you can move forward with that. You know your horse is going to be standing in that shoe for a period of time. So the photograph you seen 2 slides ago of the foot that was long, unshod, and the heels were run forward. This is the same foot. So the green line represents, again, the centre of the coffin joint. Another farrier in Scotland, Jim Ferry, came up with a guide to taking 1/3 of the length of the coronary band, dropping a vertical line down, and that would give you the same position, which isn't far away, really. The red line represents the hoof pastern axis and how much toe in front of the red line I can take off. Because if you've got a distorted toe or hoof capsule like this, you always want to look at the top 1.5 inches or so of the hoof wall, because it's usually undistorted and connected to the pedal bone. It's usually that bottom half or bottom 2/3 that distort out and become bent and non-supportive. So looking at the top half, just below the coronary band, is a pretty good guide. And again, we use that for laminitis as well. But the yellow line now is nowhere near parallel to the red line should be. The heels are underrun. So we have got a hoof capsule that is distorted at the heels and toe in this position. This time it was put on with a bar shoe to give a bit more stability to the back part of the foot. The green line again representing where we think should be, the blue line, and where the breakover is at the toe compared to the widest part of the foot. And again, the picture on the bottom right, the green line trying to line up and put the shoe in the middle of the coffin joint. Hoof capsule, this is the same day. Hoof capsule is better at the toe. Hoof pastern axis is pretty good. But again, we can't do anything about these heels. All we can do is protect them with our shoe and support them as best we can. The heels, when they're trimmed, have to be trimmed back. And it's one of those things, people think, oh, you're trimming down the heels, not leave the heels strong. But you have to have a good base to put your shoe onto and try to create a better angle for the horse to stand on. This is my, he is a really quiet ex-race horse, really good. He's a really civil guy. He has fused spinal processes. His back is totally fused. He has no pain, and he is still of excellent temperament. So he is. He's got low heels. He's got that thoroughbred foot. Did you see the pastern slightly long? It's not overly long, but it's low enough. The bottom of the foot is being prepared, already shot, already trimmed and hot fitted. But he would tend to trip. The owner was saying that he would be a wee bit trippy at times. So once we found that out, and she told me about that, I changed the shoe that I was using on him. I put these natural balance shoes on, and fingers crossed, he seems to go pretty well in them. So again, everything is tried to be centered around the coffin joint, and then deciding what shoe to put on to protect my trim, to protect the base of the foot, and facilitate whatever movement we need to take and aid as much as possible. Um, hind limbs. Hind limbs get, like I said, get the same problems as front feet. And this one, um, standing underneath herself and heels are low, needing shod, yes, but the X-ray on the right shows you the position of the pedal bone inside. Everything's collapsing backwards. And another sort of point out view to look at for people if they didn't know about it before was looking at where the coronary band's going on hind feet. That line, that red or yellow arrow, should really, if that was carried forward, will probably be about the horse's elbow. But it actually should be the angle of that coronary band. If the yellow arrow was carried forward, it should hit the back of the knee. So looking at angles of coronary bands can be a bit of an indicator as well. With it, I don't have an X-ray machine. I have to go on landmarks and hoof shape. So looking at these can be a good indicator of what's happening inside. Obviously, the X-rays gave me a better picture. And the X-ray of this one showed me there's basically, majority of the shoe is out in front. It's got a big bull-nosed effect on the hoof wall, probably because the pedal bone is in that position. Everything is sunk out the bottom. So the shoe above is what we put on. We used a leather pad this time, composite leather pad with a frog impression on it, just to try and load up and support as much as we could because it was so bad. The horse did recover quite well from this. It still needed plenty of caudal support or plantar support behind to keep the pedal bone in that position. Sometimes you don't get them back to normal. Sometimes it is a matter of management, and the management plan can sometimes change. So you've just got to see how you go with this shoeing, second shoeing, assess it as you go along. It is a lot of conversations and assessments and try. Sometimes it is trial and error. Sometimes your horse will like these pads, sometimes it won't. Sometimes it will like the 3D pads. Sometimes it will like the impression material we put in. Sometimes it won't. We have to go for a softer shore impression material. So it's just down sometimes to what an individual horse can take or not. This again is an X-race horse, prolapse frogs on its hind feet in particular, and the owner commented on lack of power from or propulsion with the hind end. I'll talk you through the pictures here. The photograph on the left is shoes off, first day, no heels at all, absolutely nothing from the midway back. The top photograph is me looking down it as if I was going to trim it. The frog is prolapsed. It's lower than the hoof wall. Everything is sinking out the bottom. This is what we talk about when we say about prolapsed feet are coming through shoes. The photograph in the center below is a photograph off the side to show you how low the heels actually, they're non-existent really. And the frog is so overdeveloped that if you take the shoes off this horse, it becomes slightly uncomfortable because there's so much frog there. One way to deal with these sometimes is to take the shoes off for 24, 48 hours and let everything sort of realign. But sometimes you can't do that. So we went with the shoeing package, and we'd had on the top there shoes, 3D pads, impression material, and that was the horse directly after being shod. So everything is getting sort of supported from the back part. 3 shoeings later, we're still in the same package. We're still using the same shoes, as in the same shoeing style and 3D pads with the 3D pads with the 3-degree wedge in them. The photograph in the middle is his feet now. So everything has become better. The horse stands better. The rider is saying the horse is more forward going. So that all helps towards saying we're on the right course here. So again, the photograph on the right is the first photograph compared to what we have now. So when I go to shoe the horse now, everything seems to have aligned itself in a far better way. So again, you go back to the shoeing package or bespoke style for whatever horse your horse needs. It can be a multitude of shoes that are out there now. There's no just one shoe does all. This is a range of what can be done and maybe needed sometimes. And I still put a lot of these shoes on horses that once you get them into these, the owners come back, the horse's temperament's improved, they're moving better, and these are on horses. Some of these horses that have got back problems, that have come back to say, owners have said, there is issues other than just the feet. So these shoes seem to help and on a way forward. So that's why we have to try and keep them in them and say it's doing the job we're wanting to do. I know once you've got your diagnosis of kissing spines, and you have problems with your horse's backs, the rehabilitation post-treatment, whatever treatment your horses went down, the rehabilitation is so important to keep your horse moving, to get it to a place again where it's hopefully pain-free first and foremost, and that it can continue on and have a good working relationship in life with you as the owner. But that takes the teamwork. That takes the owner's part, the farrier, the vet, the physio, and all pulling in the one direction. And it's all for one reason: is to get the horses what they need to keep them going and keep them as good as possible and sound and healthy as possible. So speak to your farriers as much as possible. I'd be glad to say it's the take-home message slide. And in my book, I'm on my soapbox at the minute. So regular foot care is really important, whether it be shod, unshod, barefoot, glue on shoes. Regular hoof care is really, really important. Communication with your farrier, asking your farrier questions, even though they might be a wee bit grumpy or cross first thing in the morning. A cup of coffee works a wonder, so it does. Speak to them about your horse's feet. Ask them, can you have a look at them moving up and down? Say that, things just haven't been going well. You've noticed a couple of things about your horse's feet when you're picking them out. To have that conversation, have that chat, because it's worth it, hopefully, in the long run for your horse. And if your horse is recovering from kissing spines, operation or treatment, then speak to the farrier about it. Is there anything he can do to help? Or get him to speak to the physio. Hopefully everybody will be wanting to have a conversation to get the best results. And it is just down to teamwork. So it is. It really is. And a lot of horses that when I first started would have been the vet and the farrier, and that was it. But now we have a whole team that are needed, and there's rehab centres, physios, chiropractors, acupuncture, whatever it is it takes, to keep your horses working and fit and moving. It is all part of that. It's being part of that. It's really important. So thank you for your time tonight. Thank you for listening, and it'll not be long till I can get a Guinness now. Anyway, so I'm not. So over to you, Lisa. I will stop sharing if that's what you need me to do. Or maybe you can do that.
I can't do that. I'm not IT enough. I need the IT expert here.
I think I just stopped myself there anyway. Maybe I did, maybe I didn't. Maybe the guru is going to be there.
No, I think you've achieved it. Did you get any?
Did I achieve that?
Did you get any questions into you?
I never noticed. I never looked at it actually. Oops. Maybe I'll go back again. See if I can go back again.
Or
no, that's you.
Any questions if they want to just unmute themselves and ask Martin anything. Funny, I've a sort of a general kind of question. B was diagnosed with NPA of both kinds. Now that's probably 18 months, a year maybe ago. What way does that kind of impact, them higher up as you lift the leg and into their back?
Yeah, well, having that NPA behind, they can adopt a foot under position. So your muscles, your glutes and your sacroiliac might be taking more stress and strain, and even the position of that and your suspensory ligament that can have an impact on that as well. Your muscles have to work so much harder, or the horse's muscles have to work so much harder to get that foot around and off the ground. So they really do. But higher up again, movement going forward, I don't think you develop your muscles higher up as well, and you can't create the same power if something isn't already in a negative position. And I think if we can establish horses NPA better behind and create a better platform, they will develop themselves better. They will create more power. And speaking to other farriers who have been on high-end international eventing and dressage and show jumping teams, that small changes that we do at the base can have a great impact, and riders can feel the impact of our shoeing, in that they can feel that the horse, without having done anything too drastic, they can come back to those team farriers and go, I feel like I've got more power, I've got more propulsion, I've got more energy. So, position, if we start with a good starting position, good base platform, certainly I think the structures higher up can benefit from that, and they can be used and utilised better as well. So they can. And I think there's less chance of them being overloaded and having to work and become dysfunctional, or they become a problem, secondary problem to that. Again, it is one of those things. Is it there initially, or is it there from being a secondary problem? I've read it's not a paper, but I've read an article that said that even foals that have those flaccid tendons when they're born, that might lead to that NPA in the hind feet a wee bit more, might be sort of leaning that way. I don't think anybody's actually done a study on it, but it was an article I read that, foals born with this might be one of the reasons why some of them have these negative palmar angles behind. That it doesn't get corrected quick enough or soon enough when the foals are young, and you've already lost that integrity of the heel area, and when they're foals. So it all does start really from the foals, and people who are buying and breeding, looking after foals is really important as well from day one. Looking after their feet, their conformation, and getting them correct, because that's going forward. That's your animal that has to start career at 4 and have a good 10 years in it and get to its mid-teens before hopefully there's any issues with it. Somebody put on, I think I've seen somebody put up a wee bit there on saddle fitter is important. Saddle fit's important. And yeah, our own horse at one stage we were looking for a new saddle for it, and we got a saddle fitter to come, and we tried 3 different saddles on that day. All 3, as it progressed, the horse got particularly more agitated by it all. So it did not. We didn't come away that day with a saddle fit, but we found out that the horse's back just wasn't right. Not that he had kissing spines, but there was muscular problems there. So having saddles fitted regularly and correctly, especially if you've got young horses that are changing a lot, that's really important, and that can have an impact then on the horse's gait as well. So it can.
Well, if there's a saddle fitter webinar, actually, it's going to be 2.
Yeah. Yeah. Again, what you've set up here, Lisa, is something that links everybody together. And from the bottom of the ground where I work on the feet to saddle fitters, and even bidding and stuff like that. There, it's all a huge part of just getting everybody together, which is great.
I've Pippa Cairns, the bit girls.
Yeah.
Later on, and Helen Spence is here. She's going to do a behavioural one for us.
Yeah, she's up next.
Organised for the next one, and a physio, so we're getting a good collaboration.
I know on my rounds, and I've been speaking to the clients and owners, and they know about it, and I've informed about it, and some of them have joined the group, so it's good, and it's good to have owners that are interested in going forward and trying to get things right for their horses in as many ways as possible. And it's not easy, as we know. They're sent to trials at times, but we still love it for some reason.
Anybody else, any questions? No? Well, thank you very much, Martin. Lovely to have some visual photos. So if anybody comes up with a question, I can forward it on to Martin anyway. I'm sure he'll be happy to
Yeah, there's no problem at all. If anybody has any further questions, if Lisa takes them, she can pass them on to me. I can follow them up. There's no problem at all.
And it really just goes to show, you know, how much everything is connected. One thing just can have a knock-on effect on something else, and then it just can all spiral. So it's just important to try and tick as many boxes as we can as we go along. So thank you very much.
Yeah. No problem at all. Thank you, Lisa. Thank you, everybody.